Hi guys, welcome to Brosh Dental Reviews, the website that makes our dental life much easier. Today we'll talk about perio kit. Why do we need it? Why do we need a new perio kit? And we are lucky that we have Dr. Maisie Eliezer, periodontist from Bern, Switzerland, that will explain. She's the inventor, by the way. She's the inventor with Strauss Diamond Company. And there is a very efficient and surprising perio kit. Hi, Maisie.
Hi, Ilan. How are you?
I am good, thank you. Well, this is the kit that you developed with the Strauss Company.
Okay.
It is so many burrs.
Yes, many burrs. So, when I started to do my surgery, which I would like to do minimal invasive surgery, I understood that I need burrs to go down to the root and make root planning with fine burrs. The problem is that all our burrs are very, let's say there are the burrs itself with the diamonds they are too aggressive. And I would like to have something very fine and very narrow in order to go down into the root. The problem that when I'm doing my surgery, which is minimal invasive, I don't open a flap. I'm actually only making this tunnel technique, only a pocket, a little bit of extension of the tissue, and I would like something very, very fine and very narrow to go down into this pocket area in order not to open a flap in the aesthetic zone. Because we all know that if you open a flap in the aesthetic zone, you will get a very extensive shrinkage of the tissue, and then it will be aesthetically problematic for the patient. So those diamonds that I was working together with the Strauss Company are actually giving me the versatility of many burrs and two shapes. One is long and one is ball shapes, in order that I could get into the deepest area of the pocket without opening a flap.
Before I will ask you to explain each burr, what it does and why do we need it. In general, how most of the periodontists, how they work without this kit? What are the benefits of this kit?
Okay.
Why it is so unique?
So usually what we are doing when it's non-surgical treatment and we have a pocket, let's say, of 10, 12 millimeters, what we are doing, we're taking our curette and we're going down deep into
Manually.
the pig. Curette.
Not rotating.
Not rotating instrument, just the curette going down. Or we're taking the scalers, which we know the scaler tip is, you cannot go down 10 millimeters with the scaler tip. There is a limit until where you're going. And also with the curette, you cannot go down 10 millimeters into the pocket. So actually this bird has a benefit because you can get down 15 millimeters, up to 15 millimeters, and go into and onto the root surface. So this is one of the benefits. Second benefit, sometimes when you have a calculus in the deep part of the pocket, it attaches very strongly to the root surface. And a lot of the time our curettes cannot grind it and we cannot take it. So when you have rotating burrs like those that we have in here, it can help us take out those calculus that attach very strongly into the roots. Another plus of those burrs, that if you have a very hard cement or if you have enamel purse down into the pocket, it can also shape this enamel purse or to take out the cement, very strong cement that was attached into the root, and helps us take out and help us for the regeneration of the tissue. Because if we take out the bacteria, if you take out the plaque, if you take out the calculus, if you are smoothing the surface of the enamel pairs, at the end of the day, if everything is clean, the tissue can reattach. into the
So
area.
if I understand correctly, with those burrs, you can control and achieve more accuracy?
You can achieve more accuracy. You can actually grind better the calculus or the cement or everything that you have inside the pocket. And you can go deep into the pocket, which is about 15 millimeter. What you can never do with curette alone, what you can never do with scalers alone, because they have a limit until where you can get down. So there is
the latest cases that you are showing, which are amazing, I must say, you used those kind of burrs. How long you use with this kit?
We developed it half a year ago, and for the past 6 months, I'm using those kits, using those burrs in almost any case of regenerative periodontal procedure, invasive and non-invasive. For example, if I see areas that I don't want to open a flap, for sure those burrs are the one that I'm going to use, and I'm making regenerative procedure without opening a flap, thanks to those burrs, because I don't have to open a flap. They're very fine and thin.
Interesting. So you have quite experience with this kit, but before you developed this kit, I guess that it came from some cases that you, because of a need, right?
Right.
Because you said that something is missing and you have to develop something, which is amazing because you are taking care for all the periodontists in the world now.
Yeah, it's a necessity. Why it was a necessity? Because I always thought that in the aesthetic zone, which can be from 6 to 6, yeah, because aesthetic today, the smile are very large, I would like to minimize the option to open flaps. I want to not to open a flap in order not to have a shrinkage of the tissue. So this was a necessity for me. Until I have those burrs, I used to open a flap, and every time you open a flap, you have some shrinkage of the mucosa, of the tissue. And those kind of burrs are preventing me from opening a flap. So it's definitely a necessity that I needed it, and kindly enough, Strauss company could help me with that.
So I heard 3 major benefits. One, you can control better with the burrs. You're doing more accurate when you're working subgingival. Second, you can go deeper.
Right.
And the third, is it faster than before?
Yes, this is another benefit. We know that we want that the tissue will be open, even if I open minimal invasive or if I open a flap, I want it to be open as minimal as possible, not for a long time. The longer is the worse, so you will have more shrinkage. The shorter time it's open, then it can heal better and faster. So when you use those burrs, you actually takes about, I don't know, 2 seconds, 3 seconds to take out the calculus or the cement or whatever you have inside the pocket, and smooth the surface of the tooth.
So the fourth benefit is when you use this kit, you open flap less than before.
Yes, I'm opening less time. The flap is open less time. Or if I don't open a flap, it's taking me very short time to grind the calculus compared to other options, compared to scalers, which take a long time and a lot of force on a tooth that anyhow it's compromised, it's periodontology compromised. So this, I don't put any force on the tooth, I don't have to grind it, I don't put any force, I don't move the tooth because it's all rotation. And that helps a lot after that for the healing.
Do you think for a new user it is easier to learn how to use it, or there is a learning curve that takes time?
It's a good question. I'm also giving courses about how to use curettes. And I can tell you that dentists need the courses in order to know even how to use curette in order to grind the tooth. This is easier because dentists always holding burrs in their hand. They do it for caries, you know, when they're making a cavity. They do it for preparation of a crown. So for them to hold a burrs and to do a movement of rotation of a burrs, it's much easier than to hold a curette. And this is from my experience when I'm teaching dentists, to hold a curette and to know exactly where is the surface, that doing the action, it's harder than doing that for a general practitioner.